A Dutchess County man says the home health aides he hired to care for his ailing father did a lot more harm than good. CBS 2's Bauman investigates those claims and has advice for families seeking care for their aging relatives.
I started seeing like this lack of care.
In 2020, Thomas Zahn took his elderly father into his Dutchess County home, but as 93-year-old Henry's dementia progressed, Zahn could not care for him alone.
He would get up late or early in the morning and kind of wander.
Through his father's health insurance company, Fidelis Care, Zahn found Janessa Home and Companionship Agency in the fall of 2020.
Those aides rotated, 24-hour schedule, one day person, one night person.
Zahn had previously installed surveillance cameras in his father's living space. He claims they were in plain sight and the aides were made aware. Zahn says he only started paying attention to the recordings when he noticed unexplained bruises on his dad.
I took him to urgent care. We had the x-rays done. I had gotten this diagnosis that 4 ribs were fractured.
Henry Zahn had fallen 3 days prior. His son says the aides picked him up and never reported it. Debbie Drylick is an expert in elder care.
In picking up the person, if you're not really trained well, you can not only hurt yourself, but hurt them more.
Stephen Schwartzman is also an expert in the care of aging people.
What the aide often does is they take a picture of the bruise.
The expectation is they're supposed to notify their agency of the fall. And in many cases call EMS.
Disturbed by this incident, Zahn says he checked old recordings for more. That's when he learned at night the overnight aide tied one end of his father's catheter to his bed.
It was almost like his tether, like his leash, so he wouldn't go walking around. And that didn't stop him. He just made it so much worse.
When Henry wandered at night, the catheter stretched and ripped out of him, causing him to fall.
I've heard some nasty things. That one you shocked me on. Person who is so overwhelmed and really just not properly prepared to care for someone in this situation.
The insurance company actually admitted to my client, Mr. Zahn, that this agency that they hired wasn't even properly certified.
Zahn claims Fidelis Care told him because of his location in Dutchess County, they could not provide an alternate agency. His father got an infection after the catheter ripped out. Zahn believes it ultimately contributed to his father's death, a claim Janessa denies.
The infections led to the antibiotics not working anymore, and that was how he ended up dying of sepsis.
Neither Janessa nor Fidelis Care have answered any of our questions about the allegations for this story, though Janessa denied the allegations of negligence in court filings. In a statement, Fidelis Care told us the health and well-being of our members is always our top priority. However, as a matter of policy, Fidelis Care does not comment on pending litigation. Zahn is suing the agency and insurer, alleging negligence and wrongful death.
Why did you want to file this lawsuit and bring attention to what happened?
I can't be the only one this is happening to.
Experts say there are ways to vet home health care aides.
Interview them. Ask them for references. Do your due diligence. There is a nurse's aid registry as well in the state that one can check to see if there are any allegations.
Experts tell us if a family suspects abuse, they should contact the state health department, and clients always have the right to ask an agency for a different home health aide. Bauman, CBS 2 News.